Have you reviewed ways to prevent chronic Lyme disease? I'm discussing how to prevent chronic Lyme disease as part of this Common Sense Lyme Disease series. I'm Dr. Daniel Cameron. So I'd like to begin by realizing Lyme itself was a problem. It's not just you, just not the doctor itself, but it's a complex, misunderstood. The symptoms can vary. They can affect multiple systems. They can affect the nervous system, the autonomic nervous system, controlling blood pressure and stomach problems, sweating, and the whole sensory system, and it could lead to a chronic illness. Now, most important thing is, of course, to diagnose Lyme early. I wish everyone had a tick and had a rash where they could easily be identified, that everyone would identify the rash, that all rashes would be about the same look with a bullseye pattern. But even rashes can vary. A lot of rashes can be solid or red. And then there's co-infections that we keep discovering. Most important are things like anaplasmosis and babesia. Even Bartonella has showed up in some of the blood tests for patients that have Lyme disease. Now, in the original research, one-size-fits-all doxycycline was prescribed, but maybe a third of patients were sick chronically. This is before the discovery that there were co-infections like babesia where doxycycline didn't work at all. And so over the years, there have been different treatment strategies like longer therapy, combination therapy, or adjusting the dose. I find if I lower the dose instead of raising it, I can find people who had failed treatment, they can do well and they can prevent the chronic Lyme disease that they feared. Now, I find that part of my work is public education. That's why my website, and that's why these types of presentations is to keep a dialogue going. Chronic symptoms can persist. People can stay sick for long periods of time. And so early intervention helps, but even when they finally get diagnosis, interventions can still prevent what looks chronic, what looks complicated to get better. Some people have taken a position that chronic Lyme disease is a syndrome called post-treatment Lyme disease syndrome. They have assume it's immune related, that that'll get better or might not get better, and without looking at whether there's a potential for persistent infection or persistent co-infection. I usually take a holistic approach. There's different definitions of holistic, but I usually try to focus on staying away from alcohol, staying away from processed sweets as the very minimum. I also do counseling as best I can as an internist with each and every visit, because to be this sick for this long with its effect on neurotransmitters, it's easy to end up needing that support. I try to do that rather than counsel on what supplements to take. It's important just to get down to how they're feeling, setting goals, setting directions. We need research and advocacy, research to understand this disease, research how patients respond to the disease, and advocacy so patients who have been sick for some time are made aware that Lyme is there, so we can intervene instead of leaving Lyme as a chronic illness. So in conclusion, early diagnosis helps, holistic care helps, but to prevent a chronic illness, I would advise patients not to put off treatment, and even if they think they're chronic, not to put off treatment. So this is part of a Common Sense Lyme disease discussions series that I've introduced. I'm learning from my patients all the time. If you have comments or something to share, leave them in the section below. And thank you for joining me.